So I am Kathi Apostolidis. I am coming from Athens. And I am a public affairs consultant by day and a breast cancer and patient rights advocate by heart as a second hat. I am active in patient advocacy since 1995, and I am a member of more than one Greek patient advocacy groups and of some international groups. Navigating the sea of health information was never easy for patients. Back in 1990, things were very different. The doctor was almost the only source of information for patients about disease options, prognosis, and patients would rarely look elsewhere for information. Patients often left the doctor's office with unanswered questions about their options, about prognosis, about end-of-life discussions. Patients were in the end of the 80s, beginning of the 90s, very cautious about disclosing their disease, and the cancer diagnosis was a very well-kept family secret. In 1990, I was working at the Royal Netherlands Embassy in Athens, and following a ground-to-ceiling renovation, we received PCs and internet, and we waved goodbye to the old Remingtons. That summer and July 1990, we were on the beach. When applying sunscreen, I felt something hard on my chest. I didn't pay any attention, but later in the afternoon at the shower, I stumbled upon it once more. Then I touched it and I felt something the size of a pea, and I thought I would rather visit my gynecologist on Monday. On Monday, I visited my gynecologist at the hospital. He accompanied me to the beach, to the breast clinic, ordered a mammogram. Waiting room, mammography, surgeon told me that a needle biopsy would be needed, 2 agonizing hours in the waiting room. Surgeon calls me in his office, and the surgeon, without hesitation, announced his verdict. Mrs. Apostolidis, unfortunately, you have cancer in your left breast. It needs to be removed. You will have a mastectomy. Can we fix it for next week? I was stunned, but I managed to ask, why should I have removed all my breast since the cancer is so small? I would like that the doctor gave me some more detailed information on breast cancer, what it is, how I got it, what were my options, how this lump would, I think something is wrong. There you are. Yeah. I would like that the doctor gave me some detailed information on breast cancer, what it is, how I got it, what were my options, how this lump could be a threat for my health and for my life. Instead, what I heard just made me balk at the boldness of the doctor. I did not know anything about cancer at that time. I was full of awe and respect for renowned surgeons and physicians like oncologists. The eye he used repeatedly made me understand that he would not listen to me, and therefore I had nothing more to wait from him. I left the hospital in a hurry and shock and drove back to the office. At dinner, we discussed the situation. I had heard that mastectomy was the choice for women with breast cancer, but I could not rationalize that this concerned me. I thought that for so small lesions, there should be another way. We decided to contact friends and relatives and ask about doctors and hospitals, to contact local cancer groups for getting practical information, to search in libraries and bookshops about books on breast cancer. I felt I should get organized, learn about breast cancer, and get a second or even a third opinion. The following morning in the office, first thing I started looking up in the internet for cancer patient groups, breast cancer, and the like. I ventured only on sure bet sites like ASCO, NHS, Karolinska, Hopkins Hospital, and the like. Then it struck me that I should look for information about removal of very small breast cancers. My search brought me to lumpectomy, and then I knew that lumpectomy was what I should be talking.
Hold the microphone next to your mouth.
I should be talking about with my doctor. I selected 5 leading oncology practicing doctors in different hospitals and fixed appointments in the same afternoon. The first would not discuss anything besides mastectomy. The second was bothered by my questions and boldly told me that I am looking for trouble. Similar disappointing appointments with the third and the fourth doctors. They did not give me any further information about other options besides mastectomy, and they didn't know about lumpectomy or did not perform it. So I arrived rather worried at my last appointment with a surgery professor and former director of one of the public oncology hospitals. The experience was traumatic. At 9 p.m., in his reception room was still full of patients till the elevator, and it was already 10 when I was asked into the examination room. I have waited naked for half an hour till the physician came in with his assistant. He asked her without even looking at me, "What do we have here?" Assistant, "A small tumor of 1.5 centimeters in the upper left quadrant, left breast." He turned to me and said, "Dear, we need to operate this. Your operation can take place tomorrow. I would like to see you at X private hospital at 7 a.m. in the morning to discuss details." I felt a chill coming down on my back, and I didn't like the condescending dearness. I managed to say, "But doctor, you haven't even looked at my mammogram. Will you not examine me?" "No, I will do it tomorrow. Don't forget that you shouldn't eat anything tonight and that you should be at 7 a.m. at the hospital." I dressed up hastily and ran out, coming down the escalator. At the entrance, I sat down on the stairs and cried my soul out. I was depressed and did not know what more I could do when, during the course of the week, while at the hospital for various preoperative checks, I saw the announcement for a breast cancer medical congress. I stopped for a moment, had a look at the medical congress, at the program, and realized that the surgeons presenting in medical congresses were where I should look for a doctor. I noted the name of a doctor who would present mastectomy versus lumpectomy for localized breast cancer. I visited him same day. I was very straightforward. I told him that I had already a diagnosis of breast cancer and that I have visited 5 of his colleagues who would not discuss anything else besides lumpectomy. I mentioned my internet search and that I have learned about a new type of operation for breast cancer, lumpectomy, and I wanted to know whether he would perform it. And that was the topic of my visit with him. My questions with him were, was my cancer a good candidate for lumpectomy? Does he perform lumpectomy? How other women with lumpectomy fared? How does he decide how much breast he will remove? How we shall proceed? The surgeon answered my questions more or less satisfactorily and assured me that it would not make any difference if the operation would be performed tomorrow or in a few days or weeks. Patients are interested in their particular type of symptoms and disease, and if they set out to learn about it, soon they might know enough to plan their medical appointment. A medical appointment is something very important. It deserves serious prior preparation. Doctors are like any other humans. They do make mistakes, that is, wrong diagnosis, wrong treatments, and not knowing all the options. What patients can do? Dr. Groupman, in his well-known book, How Doctors Think, presents these mistakes, but also offers advice on how patients can handle misdiagnosis or lack of diagnosis. My own suggestions so far with 2 breast cancers and a rotator cuff tear and a fracture of the shoulder and much more, is that patients should learn about their symptoms or disease and treatment options by consulting trustworthy health information sites beforehand. Start by a detailed, accurate chronological list of your current symptoms, medicines, and generally how you feel. Ask relatives and friends about information about doctors and hospitals. Search for patient support groups. Get books on coping with your disease. Check programs of disease-specific medical conferences for finding doctors who talk about new options. And I would finish. Oh, no, Miles has not put it up. I had put up a small portion of my first slide, which shows doctors and patients. Here, you see here the doctor tending a hand to the patient there that has his HRs and the medical records in hand. Patients and doctors can sail together the lifeboat in the sea of information. Thank you very much.